Hi, my name is William Brandt. I'm a urologist here at the Division of Urology in the Center of Reconstructive Urology and Men's Health at the University of Utah. And what I'd like to talk to you about today is about the causes and diagnosis of erectile dysfunction. In another segment, we're going to be talking about treatments. I'm going to try to avoid any explicit pictures, but of course, mature audiences are recommended for a subject like this. Okay, so what is erectile dysfunction? I think most of us think of it as impotence, meaning the total inability to have erection. And of course, that's one of the definitions. But it can also be an inconsistent ability to have erections. It can be the tendency to only have brief erections that go away, or not quite get as erect as the man was before. So how common is this? This is very, very common. In one of the largest studies looking at this specific issue that was done in Massachusetts, it found that about 50% of men over 50 had lost some degree of function, whether that was a moderate amount or a medium amount or a large amount. And with every 10 years those men get older, another 10% suffered from the problem. So 60% of men at 60, 70% of men at 70, etc. Now, what's the problem with that? Well, despite this being so common, only about 10% of men do anything about it, that is, seek treatment. And about half of those who do seek treatment drop out of the treatment once they start it. So what is the issue here? Why is there this barrier? Well, one of the big barriers is communication. And there are studies looking at the patient side of things and looking at the healthcare provider side of things. From the patient point of view, people want to be asked about their sexual health. And the vast majority of people say that their healthcare provider should be asking these questions, but only about a quarter of men feel that their healthcare provider did ask them questions about that. And there's studies on the flip side looking at the healthcare providers, and you find out that the healthcare providers feel the patient should bring it up because the healthcare provider doesn't want to embarrass the patient, or doesn't really know what treatments are even available, or doesn't want to open that can of worms. And so you basically have two people on either side of a dialogue, and neither is willing to broach the subject. So what are the problems that are associated with erectile dysfunction? Well, one of the biggest issues that's really come to the forefront is that erectile dysfunction may be a harbinger of other kinds of undiagnosed disorders. So for example, cardiovascular disease or diabetes. So in one study in the United Kingdom, in men who showed up looking for medication for erectile dysfunction, most of these men had at least one risk factor for cardiovascular disease, whether that was high blood pressure or high cholesterol, and many of those men had no idea that that was the case before they came into the clinic. So why is that? Well, it's probably because the blood vessel size relatively is much smaller in the penile blood vessels than they are in the blood vessels that go to the heart. So by way of example, blood vessel in the heart, let's say this big, and one in the penis maybe is this big. You can imagine that a problem that affects those blood vessels will affect the penis blood vessels well before, years before it affects the heart, causing a stroke or a heart attack. So what about diabetes? Diabetes is a very insidious disease. It affects nerves, it affects blood vessels, and it can do this throughout the body. In terms of the penis, we find that about 10% of men who come in for evaluation of erectile dysfunction have diabetes that they weren't necessarily aware of beforehand, and this is the presenting symptom. And if you look at the flip side of that, in men who have diabetes, it becomes more and more common to get erectile dysfunction. So there are some studies that would show that men over 65 who have diabetes have up to a 95% chance of having erectile dysfunction. So what are some other causes of ED? Well, there are the cardiovascular causes that I mentioned, and that's really the biggest ones. And of course, an erection must consist of blood coming into the penis and getting trapped there. And so a problem with blood coming in, which is an arterial problem, can cause it. And the problem with blood getting trapped, which is a venous leak problem, is also very common. There can also be neurologic causes. There can be hormonal causes such as low testosterone. There can be problems that we call iatrogenic, meaning the healthcare profession caused them, whether it was because of medications or because of surgery that was done on the patient. So if we were to look at this pie chart here, we can see that the vast majority of the problems are going to be blood vessel or diabetes problems, and there's a smaller number, but still very significant, that are caused by these other issues such as neurologic or endocrine. So I mentioned surgeries that are done. Well, prostate cancer is one of the very common things that are out there, and we find that about 10% of guys after prostate cancer treatment feel that they were as good as they were before they started the prostate cancer treatment if they don't do anything else about it. Now for surgery, that's obviously a very dramatic change. A guy starts one way, has surgery, whether it's open or using robotic technology, and they immediately have erectile dysfunction, and that recovers over time, whether it recovers part way or all the way. With radiation, the man doesn't typically notice the problem for a while, but over time the erectile dysfunction gets worse, and if you look at a couple years after treatment, it's about the same for radiation or surgical treatments. So in terms of medications, over 200 medications have been implicated with causing erectile dysfunction, and by far the most common ones are the medications that are used for high blood pressure. But there are other kinds of classes of medications, such as those used for depression or other psychologic issues. There are also, of course, the drugs of use and abuse, such as tobacco and alcohol and marijuana and so forth, that can also cause erectile dysfunction.